Joining me today is Donna Markham, Acting Director, Allied Health and Team Leader of Co-ordination at Monash Medical Centre. She'll be speaking at IR's Reducing Hospital Readmissions and Discharge Planning Conference, which takes place on the 25th to 26th of July 2011 in Melbourne. Hello Donna, thanks for joining me today.
Not a problem.
Can you provide a brief overview of frequent presenters to Southern Health Network?
Yes, certainly. So frequent presenters are those patients that are classified as having 8 or more presentations in a 12-month period, and they account for approximately 4% of all of our annual attendances across the 3 Southern Health emergency departments. So that's Monash Medical Centre, Dandenong Hospital and Casey Hospital EDs. Generally speaking, these patients have a peak in numbers between the ages of 70 and 79 years of age, and they're more likely to present with a mental health or a chronic respiratory diagnosis. They're also more likely to arrive to the emergency department in the presence of an ambulance or the police. They're also more likely to be admitted, and they're more likely to be single or divorced. So that's just generally a bit of a summary of our frequent presenters to our network.
And what is the Frequent Presenters Programme?
So the Frequent Presenters Program is a multidisciplinary program that we've set up across all of our EDs, and the general aim is to develop ED care plans so that when these complex frequent presenters come to our emergency department, we've got a consistent and a streamlined approach to managing their care needs, and hopefully meeting their care needs in the most timely and appropriate way, but also possibly reducing some of their unnecessary attendances to the ED as well.
And what is an ED care plan?
So an ED care plan, it's an individualised care plan, so it has a multidisciplinary focus. We've got a team of medical, nursing, allied health, ambulatory and community care, mental health and, if required, addiction medicine, and we all get together and develop an individualised care plan for these patients. So it goes through a summary of their complex issues, and it also includes guidelines and recommendations of how best to manage that particular patient's complex care needs when they present to the emergency department. So it's very specific to when they come. There'll be an alert on our system to say that there's a care plan in place for that person, and the triage nurses or the doctors or the allied health team that are looking after that patient can use that care plan to sort of guide their care for that patient.
And what outcomes have you had from the programme thus far?
The program's been operating for approximately 18 months, only a few months at Dandenong and Casey Hospital, but what we've done is gathered some pre and post care plan data. So we looked at the 6 months prior to implementing the care plan and the 6 months post-implementing a care plan. We've just done an evaluation of 18 at this stage, but of those 18 care plans, we've shown a 41% reduction in their attendances over time, so pre and post the implementation of that care plan, which is just fantastic. And we've also noticed a real increase in staff satisfaction as well, and the ability to, I guess, know all the complex care needs and know how to address that person's issues when they present to the ED.
Donna, you're speaking at IR's Reducing Hospital Readmissions and Discharge Planning Conference, which is on the 25th to 26th of July 2011 in Melbourne. What will be the focus of your presentation, and what would you like delegates to gain from it?
I'm going to be talking, I guess, generally about frequent presenters. I want to provide an overview of the frequent presenters to our network at Southern Health and describe the characteristics of this group. So I've given you a very brief sort of sample today, but I have done a 12-month retrospective data analysis of all of our frequent presenters, so I'm going to be describing in some more detail the characteristics of that group. I'm also going to discuss our frequent presenters programs and some general recommendations and guidelines for other networks about how they might like to go ahead and implement such a program. So I'm really hoping to sort of gain some interest and sort of whet the appetite of others who might be looking at doing something like this. I'm going to provide some of the outcomes of what we've done so far with our frequent presenters programs, and then I'm also going to talk about some case study examples and the outcomes for those particular patients and how we've improved their quality of life, but also helped to meet their care needs in the most appropriate way.
Donna Markham, thanks for joining me today. We look forward to your presentation in Melbourne in July.
Thank you very much.